CC15 Care Certificate, CC15 Awareness of Learning Disability and Autism by the World of Work for WOW Homecare employees. A learning disability is a lifelong condition that affects how a person learns, understands, and processes information. It can be caused by brain development issues before, during, or shortly after birth, for example, oxygen deprivation, genetic conditions like Down syndrome. There are mild, moderate, severe, and profound learning disabilities, and each person's experience is unique. Someone with a mild learning disability may need extra time to understand instructions, while someone with a profound disability might need full-time support with daily tasks. Autism, or autistic spectrum condition, is a lifelong neurodevelopmental condition that affects how a person perceives the world, communicates, and interacts. It is estimated that 1 in 100 people in the UK are autistic. Each autistic person has a unique combination of traits such as social interaction challenges, sensory sensitivities, and repetitive behaviors. One autistic person may prefer routine and struggle with changes, while another may be non-verbal and communicate using pictures or devices. People with learning disabilities or autism may also live with epilepsy, which is quite common in severe learning disabilities. They may also experience mental health conditions like anxiety or depression. Sensory impairments, whether visual or hearing, gastrointestinal issues, and mobility issues can also be present. Additionally, ADHD might be a factor. Interestingly, some individuals have exceptional skills in memory or music, particularly some autistic people. An autistic person may also have anxiety and epilepsy, requiring both mental health and medical support. They may need support with personal care, budgeting, cooking, and shopping. Social interaction and communication can also be quite challenging. A person with a learning disability may need help reading letters or attending appointments. Impact on health and well-being. Higher risk of undiagnosed conditions, stress from sensory overload can impact mental health. Example of impact on health and well-being. An autistic person may become overwhelmed in noisy environments, affecting emotional well-being. Impact on care and support needs. Individuals often need personalized care plans, communication support, and reasonable adjustments to thrive. For instance, someone might need easy-read information and a quiet room during their medical appointments. There can be significant barriers like a lack of staff understanding of autism and learning disabilities, as well as communication hurdles, such as the use of complex language. Diagnostic overshadowing occurs when behavior is assumed to be part of a disability, causing other conditions to be missed. Other barriers. Other barriers include transport and accessibility issues, the lack of reasonable adjustments like quiet spaces, and the misuse of the Mental Capacity Act of 2005. Example of healthcare barriers. For example, a resident with autism may avoid GP appointments due to anxiety from waiting rooms, which can lead to delayed diagnosis. Health inequalities. According to the Leader Review, people with learning disabilities can have a lower life expectancy, up to 20 years less. They also face a higher risk of avoidable deaths, for example, from pneumonia. The overuse of medication is a significant issue. The STOMP initiative aims to reduce this overuse. There are also barriers to accessing routine screenings, for example, cancer checks. A person with a learning disability may not attend a cancer screening due to lack of easy-read information, which can lead to a late diagnosis. Learning disability, well, it may mean needing simple, clear language. They might use Makaton, symbols, or pictures. and may need more time to process information. Autistic people, they may take language literally and might struggle with social cues or body language. They may communicate using alternative methods, for example, devices or writing. A person with a learning disability may prefer picture schedules, while an autistic person may avoid eye contact but still understand instructions. Autistic people may be oversensitive, hypersensitive, for example, to loud noises, bright lights, undersensitivity in autism. Undersensitive, hyposensitive may seek strong sensations, sensory overload. Sensory overload can cause stress, anxiety, or shutdowns. Sensory issues, example. Fluorescent lights in a GP surgery may cause distress for an autistic person, making appointments difficult. Builds trust and reduces anxiety, ensures informed consent and participation, promotes dignity, respect, and inclusion. Providing easy-read documents helps a person with a learning disability understand their care plan. Use simple language, avoid jargon, speak slowly and clearly, allow extra time for responses, use visual aids, pictures, gestures, and offer quiet spaces for communication. I supported an autistic resident by speaking calmly, showing pictures of activities and giving them extra time to respond. Use community groups, support networks, share easy-read leaflets or videos, and offer advocacy services. Connect with autism or learning disability charities, for example, MENCAP, NAS. I provided a resident's family with contact details for a local autism support group and arranged a visit from an advocate. Adjustments include providing easy-read materials, allowing longer appointments, using quiet rooms, sensory tools, adjusting lighting and sound levels. Planning is vital to ensure care is accessible and effective. Before a hospital visit, I arranged for a quiet room and familiar staff to reduce anxiety for a resident with autism. Follow organizational procedures, report verbally to senior staff, use incident forms, raise concerns via email or electronic records. Escalate if needed to CQC or safeguarding teams. I reported to my manager when a GP refused to allow a longer appointment for a resident with a learning disability, impacting their care. Key laws include the Equality Act of 2010, which protects from discrimination, and the Human Rights Act of 1998, which ensures dignity and respect. The Care Act of 2014 supports well-being and person-centered care, while the Mental Capacity Act of 2005 ensures decisions are made in the person's best interest. The Autism Act of 2009 requires services to meet autistic people's needs, and the Accessible Information Standard ensures communication needs are met. The Health and Care Act of 2022 makes autism training, such as the Oliver McGowan training, mandatory. Under the Equality Act, I made adjustments to ensure an autistic person could attend a community event without distress, supporting their right to social